Though it may feel as if COVID is quietly dying out, statistics from Hendrick Health prove that it couldn't be further from the truth. The Delta variant quickly spreading, and Hendrick officials are hoping to avoid past problems as they watch the intensive care unit near capacity. Our Noah McKinney brings us the facts in tonight's top story.
Our ICU is near capacity with 22 patients. Half of those are COVID patients right now.
Hendrick Health Chief Medical Officer Dr. Robert Wiley delivering an eerily familiar headline that we hoped wouldn't come to be.
We have a ICU that's a 24-bed capacity. We've already identified areas that we can overflow into to add close to another 10 to 15 beds.
A temporary solution with cases steadily rising, but the real hurdle on the horizon is staffing.
Last time we had this kind of surge, we had all hands on deck. Our National Guard nurses and the state nurses are not here anymore. That has definitely created a deficit.
With the Delta variant now dominating the United States, chronically low county vaccination rates aren't helping to relieve that stress.
3 out of 4 of the patients who are in our hospital with COVID have not been vaccinated.
Both Pfizer and Moderna have proven 65% effective against the variant, according to Dr. Wiley.
Even if you get COVID and you've had the vaccine, it's going to be mild disease to moderate.
Taylor County vaccination rates sit at 43%, according to State Health and Human Services, a 20% gap until herd immunity that leaves the door open for the variant to go after new groups.
We are seeing this variant be more active in the younger population.
The median age of those admitted for COVID has dropped about 20 years, now showing more in the 45 to 55 age range, an alarming development that will hopefully not become a trend.
It's really hard to convince somebody who is 22 years old, who's very healthy, who in their mind is going to live forever, to get that vaccine.
While a young adult may show little reaction to the disease, those around them won't be as fortunate.
It is still the right thing to do. To be responsible towards our fellow citizen is to get our vaccine.
Now, while preparing for the worst, Hendrick asks for cooperation so that the lessons we learned will not be in vain.
When we move our vaccines up above 60 to 65%, that is going to make a difference for our community and for our healthcare system.
For BigCountryHomepage.com, I'm Noah McKinney.
Thank you, Noah. Dr. Wiley says that elective surgeries are still being performed, though if hospitalizations continue to increase, they will look into a temporary stall to open up more beds.